Hello, everyone. Welcome to MedCity Invest Digital Health's virtual conference. This is the fourth day of our conference, and I'm very happy to welcome you all to a pitch session. Before we begin, I wanted to talk a little bit about MedCity News for those that don't know about us. So my name is Arundhati Parmar. I'm the editor-in-chief of MedCity News. Our company was founded in late 2008 to cover innovation in healthcare. We are a national publication drawing nearly 2 million page views and 500,000 unique page views per month. We cover biopharma, digital health, medical devices, diagnostics, as well as hospitals and payers in the context of the industry's overall transformation. But of course, there's deep interest in COVID-19 and coronavirus, so obviously we're covering those issues very closely too. MedCity also hosts conferences focusing on investment, population health, precision medicine, digital health, and patient engagement. We accept outside content through our MedCity Influencers program. So if you know someone or if you yourself are interested in writing for MedCity News and have a certain perspective, please reach out to me and we can certainly discuss pitches and ideas for getting your stories on MedCity News. We have another new program called MedCitizens. It's a membership and subscription-based program for startups with certain editorial and event benefits. Stephanie Baum, our director of special projects, manages that, and her email will be put in the chat in case that's something that startups in the audience wants to explore. We also launched the MedCity Pivot podcast during the pandemic because it became clear to me that every business entity and all of us personally in our lives really had to pivot from what we were used to the new normal. So we have very interesting guests, including Zeke Emanuel, and I again urge you to listen to our podcasts in addition to reading our stories online. Again, the link that's mentioned here will be placed in the chat. If you have any ideas or suggestions for guests who should be on our Pivot podcast, please do email me. Again, my email is aparmar@medcitynews.com. So a big thank you to all our sponsors, Unity Point Health Ventures, Fredrickson Byron, and Deloitte. Without them, this event would not be possible. Also, a big thank you to Medical Alley Association. Based in Minnesota, they're an industry association dedicated to highlighting and supporting innovation in healthcare in that state. Their mission is to champion and facilitate an environment that enables health technology and care organizations to innovate, succeed, and influence the evolution of healthcare. This is the third year in a row that we are partnering together to bring this conference to you. The last two were in person in Minneapolis. And now for the contest rules. Today we're showcasing 5 home health startups. Each startup has 10 minutes, 4 minutes to pitch, and then 6 minutes Q&A with the judges. Time will be enforced strictly. When there's 1 minute left, you will all hear me saying 1 minute, and that's your cue if you're presenting that 60 seconds are left. Then we'll move to Q&A. At the end of the 5 presentations, we will do a quick online poll to determine an audience favorite from today's track. Winners in terms of those, the winner that is chosen based on judges' scores will be announced on Monday at medcitynews.com. Now it's time to meet our esteemed judges. First, we have Marlon Evans, CEO of NextCubed. Then we have Austin Duke from one of our sponsor organizations, Unity Point Health Ventures. And then Cheryl Cheng, she's a general partner at Blue Run Ventures. So a little more detail about our judges. Marlon is CEO of NextCubed, an investor that creates and accelerates frontier tech companies. To date, the NextCubed portfolio companies have an aggregate value of $450 million, and over 50% of the startups are led by female and minority founders. Prior to joining NextCubed, Marlon served as CEO of GSV Labs, a global innovation platform. His career includes experience as a director of corporate affairs at HP. He received his BA in political science and an MA in sociology from Stanford University. Welcome, Marlon. Cheryl is a general partner at Blue Run Ventures, an early stage venture capital firm focused on seed and Series A opportunities. Her background includes M&A along with brand management and marketing. Some of Cheryl's investments include Hello Heart, Send With Us, and ZMe. Prior to Blue Run Ventures, Cheryl worked across innovation and retail marketing roles at Clorox and the Sharper Image. Cheryl has a BA from Stanford and an MBA from Kellogg School of Management, where she was a Forte Foundation Scholar. Welcome, Cheryl. Austin Duke is Senior Venture Associate at Unity Point Health Ventures, where he helps lead all investment activities, including sourcing, diligence, execution, and post-investment support. Prior to joining Unity Point, Austin served as Chief Science Officer at Nexion Med Systems, where he led scientific, clinical, and regulatory activities in the support of the development and commercialization of Nexion's neurostimulation technology platform. Austin obtained his PhD in biomedical engineering from Vanderbilt University and his BS in biomedical engineering from North Carolina State University. Welcome, Austin. Now it's time to meet our Pitch Perfect finalists. We have 5. Omcare, Face2Face Health, AireHealth, ELANZA Wellness, VigilantDX. So we'll start with Omcare. This is a digital health company pioneering a product platform that enables remote care in the home, extends the reach of caregivers, and redefines medication adherence. Lisa Levine, CEO of Omcare, will be presenting first. Please take it away, Lisa.
Thank you very much.
Your time starts now.
If COVID-19 has done anything, it has underscored the need for remote care in the home. The home indeed has become the place of service for healthcare services today. We are Omcare. We're a digital health company pioneering a product platform that enables remote care in the home, extends the reach of caregivers, and promises real medication adherence. Medication adherence being right medication, right time, right person. We envision changing the way the world cares in mental health, aging, and chronic complex market segments. Our objective is to improve health, caregiver efficiency, patient experience, and reduce cost. There are a number of ominous statistics of why we exist today. Social isolation certainly being one due to COVID, but also we're looking at the fact that 50% of people that are taking medication today are non-adherent. And 50% of our population have at least one chronic health condition, accounting for 75% of our healthcare spend in the United States. With that, on top of that, we've got 10,000 people every day turning age 65, and failure to take medication is the leading cause for older adults not able to maintain independence and stay in their homes. All the while, we have an ongoing, growing healthcare shortage, caregiver shortage. Introducing the Homecare Home Health Hub, an in-home portal for easy-to-use one-touch 2- and 3-way video calls, human and smart medication assistance with preloaded pouch medication, and visual confirmation of medication adherence. Today, if you want to ensure real medication adherence, you actually have to show up at somebody's door, hand them the medication, and watch them take it. This is just not feasible, but this is what Omcare does now remotely. This is a 2-camera system that allows a caregiver to see their client's face as well as to see the pill tray. I can watch my client grab the medication and put it into their mouth, tracking this adherence longitudinally over time. But further, we've created an open API architecture whereby Omcare becomes a conduit of other care services into the home. Omcare stands alone from a competitive standpoint. We're a med dispenser. We're an easy-to-use video chat device. We're a telehealth portal. We're a means of remote, direct observed therapy. And we're a biometric wearable and sensor integrator via Bluetooth. Omcare is designed to be a conduit for existing infrastructure and services into the home. Our go-to-market strategy is all about partnerships with home health, telehealth providers, pharmacies, payers, as well as technology companies. Partnering together, we can increase patient access, improve health outcomes, and reduce cost. Our money through the sale of our products through and to
1 minute.
Our healthcare partners with a nominal monthly cloud service subscription fee per device per month. We started development in 2017, and this was based on a platform that was established in a previous market vertical. We've got 4 issued patents. We were listed by the New York Observer as one of the 2020's hottest tech list. We're launching into pilot in Q4 with Ecumen and Thrifty White Pharmacy and rolling out national with our other partnerships in 2021. We've got a star-studded board, a leadership team with over 135 years of leadership experience. With this team, with this validated technology platform, we're ready to change the way the world cares. If you want to learn more, let's chat. Thank you.
Great, Lisa. Let's go to first to Marlon and then to Austin and Cheryl.
Hey, Lisa, thanks for the presentation. Great job. Just a question about the dispenser. Who manages how the medicine that is put into the dispenser? Is that on the patient? How does that process work?
Yes. So one of the decisions we made very early and upfront was the fact that we did not want to get in between the relationship of the pharmacy and the patient. So the pharmacy fills all of the medication in the multi-dose strip pouch medication. A reel is delivered direct to the consumer's home and either loaded up by the consumer themselves or loaded up by a familial or professional caregiver. We have a direct integration with the pharmacy system. So as soon as that reel is loaded up and our system reads the first pouch, we know exactly what is in every single pouch and as we dispense each pouch.
Got it. And I saw there was some connectivity with the phone. Is that just, you can either use the device as the visual, or you can use your phone as well?
So the way in which a caregiver connects to the device that's in the client's home is an app that is on their iPhone, their Android phone, tablet, or computer. And so as long as I have the Omcare app and I am a credentialed user with a username and password, I can access and talk to and communicate with and assist that client.
Thank you.
Yep.
Let's go to Austin.
Thanks, Lisa. Definitely a great presentation. You're hitting on some big topics, things that we are certainly paying attention to at Unity Point. I'm going to cheat and ask a couple of questions. Just first to clarify, on the directly observed therapy, is that synchronous or asynchronous?
So we look at really both. I mean, this is the possibility of visual confirmation of any therapy, whether this is medication that's being consumed, it's medication that's being injected. It could be therapy that could be physical therapy, but it also is a means of the telehealth platform. So I can serve up services as well as observe the therapy.
Okay. And then the second question was on your go-to-market strategy. You listed working with a lot of partners and sort of a broad spectrum of people that you'd work with. Can you talk a little bit about where you're going to focus initially and maybe where you're at in that process in terms of pilots or distribution agreements, that sort of thing?
Yes, we're starting with our initial pilot, the 2 partners that we have in place, which is Ecumen. This is a home health as well as senior care company that is headquartered here in Minnesota and has pretty broad reach in about 6 states. And they have, I think, over 40 different facilities. They've been looking for a means to be able to extend their reach into the home, to reach further upstream, to build their clientele and provide services to help people maintain independence. So Ecumen is our first provider partner. It's those kind of provider partnerships that we're developing. Now on the pharmacy side, we've developed a partnership with Thrifty White Pharmacy that has over 100 stores and licensed in all 50 states to be able to distribute medication direct to people's homes. But having said that, we're also working on expanding our pharmacy partnerships so that our consumers have choice.
Thank you.
Thank you, Austin. Let's go to Cheryl.
Hi, Lisa. So my question is, and maybe I missed this, but how much does it cost? Like, through the channel or to the customer, how much does the device cost? And then, the medication, do you collect a revenue stream off of that for refills?
So the 2 revenue streams that we do have is the sale of the device, both retail as well as wholesale. So retail direct to consumer is tentatively to be around $899. There will be a wholesale pricing as we sell through our partnerships. And then for each device that is in the field, there is what we call a Netflix fee, a $9.99 cloud services fee that enables people to track the adherence and have access to that data, to be able to video record. If we're doing smart medication assistance and not human medication assistance, we can video record that event so a caregiver can look on later on to see if somebody was indeed adherent. And also it includes 24/7 tech service support.
Okay. And my second question is, to date, how many, do you have units out in the field? Like, are people using them already? And is it, are they paying the, $8.99 price plus the subscription, or is this more of like a pilot right now that you're testing for engagement?
We're weeks away from being in the market in pilot. So we'll be first time in market, coming up again with Ecumen and Thrifty White Pharmacy in Q4. But oh, by the way, we're also scaling up for national launch with our contract manufacturing partner in early 2021.
Okay, got it. Thank you.
Yep.
Great, thanks very much, Lisa. We will continue to move forward with our next presenter. Face2Face Health is a transformative digital health platform providing parents with a single end-to-end solution to help optimize healthcare for their kids. The solution uniquely integrates health literacy, e-learning courses, telemedicine access to multidisciplinary healthcare professionals, educators and advocates, expert-led webinars, and web forum communities for sharing knowledge and support across 5 pillars of care: general health, emotional health, development, mind, body, nutrition, and education. Advocacy. Ami Shah, founder and CEO, will be presenting next. Ami, please go ahead.
All right, great. Can everyone hear me?
Yes, we can.
Okay, great. I'm just going to start from the beginning. All right.
Your time starts now.
Okay. Hi, everyone. My name is Dr. Ami Shah, and I'm a single mom, a former pharma exec, and most importantly, a late mamapreneur, and founder of the first integrative medicine platform for children called Face2Face Health. And we did an amazing article with our partner Working Mother magazine that highlighted the challenges that we all now globally face, especially during COVID, getting access to care, getting access to knowledge, doing all of our karate and sports and everything via Zoom. And we totally understand what it is to be faced with COVID, but I had a different challenge. Both of my twins had challenges and delays that took me on a journey where I talked to over 1,000 parents and 500 providers. And we all shared 3 major pain points: access to curated, peer-reviewed, health literate information right at our fingertips with tools and resources to help us as we wait to see our providers, access to the right care team, and access to communities. For me, it was a very lonely journey, despite knowing so many physicians and so many other experts. And I'm not alone in this journey. Research shows that over 88% of US adults are health illiterate on some level, just like me. They have no access to the right information. If they do, they spend an average of 20 hours online and they get conflicting information, and then they can't ask anyone a question. There's no one place or one environment to get access to that information and care. And of 90 million kids, 30% are screened for any issues. And these delays in diagnosis and absenteeism cost corporate America over $250 billion annually. As I mentioned, this is a birth of a collaboration between 1,500 people and myself. And that leads to our platform, Face2Face Health. And it's no surprise that the top challenges for children in our healthcare silos cost the healthcare system over $200 billion annually in direct costs. And most importantly, they require multidisciplinary support. It's not only the doctor, it's the educator, it's the PT, OT, speech, the art, the nutritionist, the creative arts therapist, the tutor, who work as a team to help that child optimize their well-being. And so our solution is integrative in nature. Not only do we offer care, advice, expertise, webinars, communities, demos, we offer advocacy and support, which is my favorite feature, all in one secure place. And our solution is integrative in nature, learn, care, share, with several third-party integrations so that parents get the best care for their children and providers have the best tools, from remote monitoring to exercises to diet plans to supplements to prescriptions, all in one place. I want to talk a little bit about our learn, because none of us have a roadmap for parenting or GPS. We all use What to Expect When Parenting or Expecting. There's 125 top courses based on analytics on what parents search for, what insurance companies treat, and what providers diagnose. And we automatically have peer reviewed with over 1,000 experts from 90 specialties, all the apps, toys, books, and games. This is no WebMD. It's much more powerful than that. And all of our references are aggregated in one place. So our product position is quite clear. We've aggregated all the tools for both customers and our providers. Our care is on-demand, scheduled, or concierge. We don't just give advice, we give care and we'll come to your home. We have labs, supplements, multidisciplinary coordination, and a smart EMR with over 100 forms. And our share community has webinars from mindfulness with a Grammy-nominated singer, Falu, to other areas and topics that give parents real-time support. Our value proposition is clear for parents. Everything is in one place. For businesses, we save money, and for providers, they maximize their revenue and can collaborate and connect with other providers.
Time's up.
Are my time's up?
Yes.
I'm so sorry. So we have traction and we have a great team, and thank you so much for your time.
You can probably get to some of those slides through the judges' questions.
Okay, thank you.
Let's go to Austin first.
Yeah, since we ran out of time, why don't you tell us a little bit about your revenue model and maybe how that connects to the value propositions for each stakeholder?
Sure, absolutely. I don't know if I can actually show the traction slide. Can I do that or not?
Yes, you may.
Okay, thank you for that flexibility. So our revenue model, we looked at the current top 150 telehealth providers, and we basically charge on a 10-minute slot for medical and non-medical providers. We're 10% cheaper than the top 10 companies, and we pay 10% more. For the Learn, we have a B2B2C volume-based SaaS model where we've been integrated as an offering with third-party administrators, insurance companies. We're doing a huge deal with Wakefern and Kimberly-Clark that's launching, the NFL. We have Kpis, Working Mother Magazine. We have several voluntary benefit platforms and several other solo practitioners who are promoting the education, webinars, and communities because they see the value of the tool. I
mean, we didn't see the slide. If you want to quickly show it.
Oh, gosh.
That's okay.
Sorry. I'm just not tech savvy today. So this is our revenue model. We have a B2B2C volume-based SaaS pricing model. We already have signed major deals with third-party administrators, HR companies, self-insured companies. We have a deal with Wakefern, which is the 4th largest food and beverage company. They have ShopRite and Kimberly-Clark that's going to be launching for the education content. And we also have a lean direct-to-consumer pricing at $79 per year for the education, the communities, the webinars and such. And then the telemedicine consultations are with over 50 different specialties across general health to education. And we actually did a competitive analysis and we priced it. We basically are 10% cheaper than the top telehealth companies out there and pay 10% more. So there's our average cost between a medical and non-medical consult. And that's our revenue model.
So quick.
Okay, great. Thanks, Ami. You can stop share and we can go to Cheryl.
Austin, did you have a follow-up question?
Yeah, if I can, but I can wait and let you and Marlon go ahead and we can
No, go ahead first. You're on a roll.
On the Learn pricing model. So I'm a parent. I don't know anything. I absolutely get that there's a lot of information out there, a lot better information maybe than what I have. But I think most of the times, from my personal experience, that feels most acute in an acute problem. How do you go to a consumer and convince them to pay in advance for education materials related to their child's health?
Yeah, that's a great question. So we have over 10 committed B2B partners already, some pretty big names. And once they see the experience and they see it's based on the top conditions, 30% of which is mental health, it's really empowering yourself. We all carry that What to Expect When Expecting book. We highlighted it. A lot of that stuff didn't work yet. It was a multi-million-dollar seller. there really is no GPS roadmap. We want to talk, you really want to show the value of the apps, the toys, the books, the games, the nonprofits, the thousands of resources aggregated from several sites, so that if something is on your radar, then you can immediately get screened right in our platform. And if something comes back positive, then you can immediately get care right in place, right from the comfort of your own home. And so health, when we looked at the data out there, over 35% of the information on the top 100 sites for each topic was inaccurate, outdated, or not peer reviewed. And I, as a physician, had that personal journey with my own children. Did that answer your question, Austin?
Yeah, absolutely. Thank you.
Good.
Okay, Cheryl, go ahead.
Okay, so I think maybe to follow up a little bit in Austin's question, how do I as a consumer know that your information is more accurate, more more up to date? Is the big deciding factor in your business that you built a brand, or is there actual like clinical outcomes that you would point to and say, this is why we're better?
So that's a great question. And we have both components. So we used over 1,000 experts from 90 specialties to do all of the information. We used a team of over 60 health literacy writers to do all the research and pull everything. At the end of each module is a reference tab, and you get to see each module has about 7 pages of science-based references. Everything in our modules is peer-reviewed, evidence-based science, and less than 3 to 5 years old in knowledge, number one. Number two, the outcomes are already shown in the data we use to build so for example, if there's a natural supplement that works for depression, all of the case studies, all of the peer reviews, all of that information is right there at your fingertips and presented to you in the module itself. So everything in our platform, I was astounded when as a doc, I'm like, what is this? What is that? What is this? Then my pediatrician's like, oh, I can see you in 3 weeks. I'm not going to wait 3 weeks. There's no way. I'm not going to wait 3 weeks to get the information I need. And so I can put my academic hat and say, oh, this has good evidence. But you know what? Not everyone can do that. So everything in our platform is very visible, all the evidence, all the references, everything. And it's all been peer reviewed. Every app, toy, book, game, all of it. And it's all hyperlinks. You have to go to 400 different sites.
Mm-hmm. And this is unrelated to my first question, but for your B2B model, how are you charging? Are you charging per employee per month?
Yes, we have. So our Wakefern is per member per year. They're going to do a series of Kimberly Clark and Wakefern did a very deep due diligence of our entire platform on education. They were both super excited. So they're going to do it, with a diaper promo, a baby promo, you get a free subscription. We also have per member per month, and it's volume based. The wonderful advisory board, we have a star-studded advisory board. She's actually has 35 years of experience in B2B2C subscription-based revenue model. She runs Subscription Insider. Her name's Kathy Sexton. She led all of our pricing. So it's really volume-based. It's based on for-profit, nonprofit, voluntary, or all access, whether you want to let the employee choose that extra benefit or if you want to provide it as a direct benefit.
Got it. Okay. Thank you.
Yeah.
Let's go to Marlon.
Yeah, just curious, where do you see any early indications on where you think the revenue is going to come from? Is it more on the care side? Is it more on the learn?
That's a great question. There isn't. So I've been practicing telehealth for, oh my gosh, I can't believe I'm going to say this. I'm so old. 20 years. So I started with Teladoc. Then I went to, I've worked with, the average physician is on 12 telehealth platforms, by the way. I was actually on 21 at some point. And I will say to you that pre-COVID, I would probably say care. And there is no platform that connects all of these pieces, learning, caring, and sharing in one place. Yet so many parents spend an average of 20 to 25 hours a week trying to look for information and rely on Google Google diagnosis, but 35% of it is outdated and not peer reviewed. So it's a danger. So I would say that I would predict probably the care and the learn probably 60-40. That's what we've based our financials on. I have an awesome CFO, did a lot of modeling, but it's hard because there's not another Apple out there to kind of match it to.
Got it. And you mentioned just it's hard to work through all the information. How are you keeping your information up to date? And
okay, so we update it twice a year. We just did the update. It's 2020 updated. We have a whole team of nurses and other healthcare professionals who are also medical writers and health literate that go out and search all the information. We have a blog, we have a cooking demo, we have all kinds of cool stuff. And so all of that information, each expert keeps vigilance. We have all of the references organized in a database. And so we're very vigilant with the information and making sure it's the best that's at the parents' hands.
are all those individuals on payroll? Are they being compensated?
Oh, absolutely. We don't have W-2 yet. Even I'm not paid yet. Come on, startup. We're self-funded, 1.2 million on purpose because I did a lot of M&A in my 20 years in pharma. I know, self-fund as far as you can. We're about 1.2 million in. We have 11 investors with a 50K lead from our advisory board, and now we're doing a raise.
Perfect, thank you.
Sure.
Thanks very much, Ami.
All right, thank you so much.
Perfect. We are going to move on to our next presenter, Vigilant Diagnostics. Vigilant Diagnostics' advanced technology greatly reduces time to diagnosis, as well with sensitive digital point-of-care results, usually found only in lab tests for a wide variety of infectious diseases. To date, the company has raised 1.2 million in equity investments, plus around 1 million in research and development grants. Rick Carlson, CEO, will be our next presenter.
Okay, thank you. And anyway, Vigilant Diagnostics was formed in 2014 by two individuals to focus on high sensitivity point of care diagnostics. When we started, our primary focus was in malaria. That's where we cut our teeth as a company, and we're successful in developing a point of care LFA that was exceedingly sensitive, more sensitive than we were actually thinking would be possible. And from that point forward, we've continued to work in pretty much all of the infectious diseases. The problem that we focused on is the concept of infectious disease testing, and in the past it's been a rather subliminal issue for people, but in the COVID-19 days, it became very visible, both in their personal lives and in the media. And for us, the concept was we first wanted to address the most sensitive issue that we see in here, which is the time to have a test not only completed, but the results returned. Low sensitivity was also a key factor. A lot of the tests in the early days had very low sensitivity. But we also wanted to deal with reproducibility, which patients today that are receiving these kinds of tests are tested obviously many, many times, both pre and post disease diagnosis. And then the last thing, which was sort of a derivative result, is we wanted to avoid patients having to travel. So point of care was obviously our focus. And that proved to be very important because as we began looking at the needs of the market today, they are totally different than they were 4 years ago. Our number one goal is to be able to generate results in less than 10 minutes. We've achieved that objective and believe that we can get down to as low as potentially 2 minutes in testing. We also wanted to obviously improve sensitivity. We have demonstrated already in laboratory tests our ability to improve sensitivity up to 250 times. And I can talk more about how that is achieved later on. Our results are also digitized. We actually create a numerical value that can be measured and monitored and tracked over time. Being user-friendly is obviously important, and our test is based on lateral flow assay technology. Reproducibility, as I mentioned already, is been demonstrated in the tests we've done. And of course, the idea of not having to travel with a point of care test is critical. In our view of this marketplace, we start with something as simple as a point of care test, potentially in a physician's office, but we see potential to take point of care all the way to the patient's home. Our technology is based on thermal contrast amplification, TCA, as we describe it. It's a technology that generates, we use a low power laser.
1 minute.
Go ahead.
No, you have 1 minute left. So
oh, okay. And we address all of these different diseases and our ability to detect those things. Market opportunity is a slide that we put up only to remind ourselves that this is far beyond what is shown. To date, our traction is demonstrated in this slide with 2 approved patents. We're on to our 3rd generation system. The one you just saw in a slide will be released within the next 3 weeks. We've got 9 reviewed publications, and we've generated about $1.8 million in funding. Our goal is to raise $1 million as transition funding to get to FDA and to be able to go to the market. This is a part of our management team, headed by John Bishop, our founder, Jim Sackerson, our chief technical officer, and I'm serving as a board member and interim CEO.
Great, thank you very much, Rick. Let's first go to Cheryl.
Hey, thank you. Sorry, I was on mute. I read your executive summary, and it wasn't clear immediately to me. Are you going after a in-home, like direct-to-consumer go-to-market, or are you thinking to sell to like schools and businesses where they want to be able to test people very quickly? It was not clear to me, like COVID versus something like HIV, very different, right? So,
sure. Yeah, our classic dilemma, Cheryl, has been to decide where that arrow is pointed. And as you would expect, things like COVID force you to reconsider some of your assumptions. But our initial focus was to build products for strategic relationships, like the OraSures of the world. We've got 10 or 12 organizations that we are in communication with. And as soon as we complete the China development program that we're working on now, they will be doing testing. So our initial focus was directed in that way. Since COVID developed, it became clear that to go back into the home care health market is really a key pivot point. But for most of our initial efforts, it'll be focused on non-home care technology. The system you saw is about the size of a home blood pressure testing machine. And we believe that to get into the home care market, we not only have to downsize our equipment a bit, but also to be able to develop lateral flow assays that are a little bit easier to use. I will say this though, if you look at other, and I'll pick a really simple example, we focused initially on some things that involve what I would call crisis applications, where if you had a meat packing plant, if you had an ability to test all of those people as they were coming into work with a highly sensitive test, we've had numerous discussions since COVID-19 with organizations, and you can start with a group we haven't spoken to, something as large as the NFL, airlines. There's a number of very highly focused applications. And we've got to sort through that, but our first approach is to develop technology for strategic partner relationships.
Okay, thank you.
Let's go to Marlon.
Hey, Rick,
hi, Marlon.
Rick, can you say a little bit of the economics? I know you were saying you're kind of downsizing the size of the model, but just...
Sure, yeah. There's not a magic number for us, but as we look at what we would call testing outside of the home, but not in a laboratory setting. we're looking at a price point that is somewhere in the $600 to $800 range. And that's why we went offshore to do a development program in China that will enable us to be able to hit that price point. If we get into the home care health market, obviously it has to be lower. Lateral flow assay costs are easy to manage in volume, and that's not a significant milestone for us to overcome. We believe we can do that. We've got some great relationships in place to accomplish that.
Great. And have you explored other potential revenue streams based on the data that you may be collecting from the patients, or?
Yeah, if you're talking about managing data as one alternative, one of the really unique attributes of this device is if you combine diagnostics with tracings, our device gives you reproducible results that can be tracked over time. So we believe that that's going to be instrumental, particularly as patients come out of treatment programs where they've had the disease and have to be slotted back into both their job and society in general. So we think that's a major function that we can provide with our quantitative results. That's one revenue stream. Right now, though, we're primarily focused on being able to develop reader and LFA technology.
Great, thank you.
Mm-hmm.
Let's go to Austin.
Hi, Austin.
So Rick, following up on that last point there, you talked a bit about things that you've done in terms of clinical studies and patents, et cetera. How far along is the technology in its development, and then how far along is the product in its development?
Yeah, good question. We are actually, the unit that you saw on the slide is by definition our 4th generation system. The 3 previous ones were used to validate the technology in a clinical setting. And to get from generation 3 to generation 4 in terms of size and cost is a fairly significant challenge, has been. But right now, we believe that this China unit will be available within the next 2 to 3 weeks. It still has to go through some validation testing, both here and there. And at that point, our objective would be to put it in the hands of 6 to 8 strategic partners who we've already been in communication with to test their specific kinds of market interests.
Have you done anything by way of usability testing, validation of user needs, that sort of deal?
Yeah, we have. The biggest focus is increasing the sensitivity of our device. That is achieved with a couple different parameters, one of which is we use gold nanoparticles as a part of the product, and as we change the geometry of those things, that dramatically improves, we can dramatically improve sensitivity. This is a device that is designed to be able to be used. So if you think about a kind of a rapid deployment to an area that has a major outbreak, these systems are designed to be operated by just about anybody without any training. This does not require extensive experience. The equipment itself is totally automated. The only requirement is you have to put the slide in the proper holder position, and once you do that, it's all automatic. So the concept of a rapid deployment of testing capability is essential to have, and to do that, you have to have a system that is exceedingly easy to use.
Great, thank you.
Yep.
Thanks very much, Rick, for that.
Yeah, thank you. Appreciate the opportunity.
So next up is AireHealth. It is a virtual respiratory care company offering an in-home solution for at-risk, vulnerable respiratory populations that can significantly improve outcomes, lower costs, and reduce hospitalizations. Stacy Ruth, co-founder and CEO, will be our next presenter. Go ahead, Stacy.
All right.
Perfect. Your time starts now.
Did you know that your lungs tell a story about their health? Even before you exhibit symptoms such as a persistent cough or a wheeze, or even have an asthma attack. Hello, my name is Stacy Ruth, and I'm co-founder and CEO of AireHealth. AireHealth is an innovative digital health company, and we're empowering people and improving respiratory care in the home. We do that with affordable drug delivery. We have a nebulizer product, symptom tracking, early detection of respiratory decline, and our solution, Vital Breath. In short, it saves lungs and saves lives. Specifically, we support 150 million people in the US that are respiratory compromised. We help them stay home. We help them be more proactive with their care. But who are these people? These people are individuals with asthma, COPD, respiratory viruses such as COVID-19. This population accounts for $130 billion in annual healthcare spend in the US. For an example, 46% of COPD patients actually have a hospitalization each year, and 22% of those people will be in the hospital more than once. So we did something special in June of this year. We saw the opportunity, especially with respiratory coming so much to the forefront with COVID. We bought a company. We were a med device company at the beginning of 2020, and now we've accelerated our roadmap and we're a virtual care company for respiratory. We're starting pilots in January of this year next year with our new platform. So why does the vulnerable population of respiratory at risk, why is it such an intimidating outcome and an intimidating and high cost? So often these patients receive delayed diagnosis. It results in delayed treatment, unnecessary hospitalization. Our virtual care platform, Vital Breath, along with our companion applications and connected respiratory devices, is the answer that the market is seeking. So unlike other digital health companies in the market today, AireHealth will be able to tell if your lungs are performing better or worse than they were yesterday, if you're responding to your therapy, if your symptoms have escalated to the point where you need a second set of eyes or intervention. The market calls this remote patient monitoring, and it is reimbursable through insurance today. So we make money by providing FDA-cleared respiratory devices, such as our nebulizer and a spirometer. We do that with payers that manage the prescription all the way through the billing. We help them with that. And we have a PMPM revenue model. But it's really important to understand that these patients are always in one of these four journeys: patient self-care, escalating symptoms, post-acute care after they've been in the hospital, and chronic and high utilization. So we chose a very special spot to start. We're keeping people out of the emergency room once they've already been there before. As you can imagine, this is a gigantic market, projected to have over $13 billion in revenue, and our addressable is already $2 billion a year. We will grow our revenue to $2 million in 2021, launch our Vital Breath platform into the home health space. So I really want you to know about our team. We rock. So I myself have 20 years of med tech experience, 150 years combined. I want you to know we have in-house development, regulatory, and commercialization. Our solutions are heavily backed by IP, 4 patents pending, and since announcing the acquisition of Breath Research, AireHealth's interest is through the roof. We do have an ask. We're raising $2.5 million in our seed round, and we want you to help us achieve our full potential. If you're a payer, if you're a provider, if you're an investor, we want you to reach out. Thank you for your time.
Perfect. Thank you very much, Stacy. Let's go to Marlon first, and then to Austin and Cheryl.
Hey, Stacy, great presentation. I'm a longtime asthma sufferer, so I appreciate what you're building. Just curious, with that in mind, so there's you take the inhaler, it's giving you some sort of reading. Are you then making recommendations as to how you should treat your symptoms, or?
No, so what we're doing, so it's a nebulizer, which is a little different than inhaler. An inhaler is a class 1 device like that you pump, right? And it pushes with propulsion, it pushes it to your upper respiratory tract and delivers medication. And nebulizer is different. We have a class 2 clear device, and it delivers medication directly to your lung. Okay, so it's a little different of a technology.
Okay.
Would you kind of repeat, you had a little broader question than that, but I wanted to start with what is the difference? Okay.
Yep. No, that's helpful. And then are there certain signs or certain things that will appear to let you know you should take this action or that action or?
Yes. So what we're doing, so you can't actually diagnose without a clearance to do so. And that's a pretty aggressive clearance through the FDA. So our application is a companion app. And what it's doing is it's taking the symptoms that you report and direct data from the nebulizer, from the spirometer next year. Okay. When it takes that, it passes it through, and it does run it through an analytics engine, but we're not recommending a change in treatment. We're recommending to the provider that you take a look at this particular patient because they've had multiple episodes or exacerbations of their symptoms. So right now the tech isn't telling, it's the doctor that takes a look and tells the patient what to do.
Perfect. Thank you.
You're welcome.
Let's go to Austin.
Hey, Stacey, enjoyed the presentation. Would love your thoughts on the competitive landscape, sort of where you are different, where you're better, kind of where you try to play. And then along those same lines, would just be interested in your thoughts on the Propeller Health outcome from last year or so, and kind of how you take that into account when you think about what you're building.
Okay, that's a great question, and they're actually complementary to one another. So let's talk about severity of respiratory disease, okay, on one axis, and let's talk about the amount of intervention that you're having on the other axis. So most of the companies in this space are actually, they're down at we're not dealing with highly severe cases of respiratory illness. Right. And most of the other cluster of that is we're dealing with severe, if you will, but there's no data associated with it. So we're in this realm, but we're not doing it from an analytics standpoint. So where we're similar and where we're different than Propeller, they're doing inhalers. So I explained that to Marlon first. We're doing nebulizers. Doesn't mean we couldn't be complementary in that way. We're dealing with a more severe, more remote monitoring focus with a pulmonologist. So we're going after a particular use case, severe COPD, and we're going after not people who have the more transient disease, but more the severe disease and they've already had a hospitalization. So we're going right for that most severe patient. So again, complementary, very, very solid strategy that Propeller's put in place. They're going after a little different use case than we are, and our technology's a little different.
No, that's perfect. Appreciate it.
Let's go to Cheryl.
Great, thank you. So I guess my question for you is, your strategy seems predicated on this is prescribed by the provider. And does the provider say, Cheryl, you have COPD, like you should use this, and your channel is purely through the provider, or you also will go through other channels? And I guess from a monetization perspective, my question is related in that, who pays for this? Like, will this be, is there a CPT code or something that automatically bills back, or what are you thinking?
Okay, so I'm going to start from the last question because it really frames up the go-to-market model and how you pair it. So first, it will be reimbursed. There are 5 remote patient monitoring or remote physiological codes, okay? We're utilizing 3 of those in our business model. We're utilizing the provisioning of the device. This is at the provider level. We are utilizing the device and data. So when you put a device into play, there's a reimbursement for that. That's $69 a month. The provisioning is $23 one time. The last is a $97 monitoring fee that has a threshold of check boxes that the provider has to check. And when they check each one of those, they can bill against CMS codes, right, for $97 a month. So virtually, it's a reimbursement through RPM, and we're profit sharing or sharing that with the provider. Now, who is the provider? So first of all, COPD, there's 25 million of those people. 46% of them use a nebulizer already in the home. Now they're antiquated, they're not connected, but we're going to do better with that, right? It's been kind of an underserved technology market. But the device itself is not the important prescription. It's the drug that goes in it. We don't manage what goes in it. We are not involved in that prescription of the drug. We are a device that gets provisioned into a program. So although we are an FDA cleared class 2 device, because it's a certain level of safety and efficacy that has to be proven to the FDA, we are drug agnostic.
Okay.
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 I think I answered all those. And who is the provider? It's actually more commonly the prescriber is the PCP than a pulmonologist. Pulmonologists see these guys 3 times every 3 months, but normally the person who's engaging with the prescription is the PCP.
Okay. And what are you thinking about, because COPD is so prevalent among, CMS patients or like Medicare, Medicaid patients, what are you thinking in terms of clinical outcomes? Like, what is the engagement level that you feel like you're going to need to hit to declare success? What does that look like?
Okay, so as a seed company that's preparing for the 2 milestones we need for A, our 2 milestones that we need for A, and we're looking for collaboration and funding to do this, we need our pilots that launch to do 2 things. They create commercial relationships and show traction, and we need to be building evidence. Before we ever build evidence for regulatory, we need to build evidence for the payer community to help understand that we are lowering costs and we are improving outcomes. So one of the pilots, we're going to do 3 types of pilots. One will be with a payer. Okay, we already have that in the works. But I'll tell you that, yes, almost 60% of these COPD patients are Medicaid. Okay, many of the remaining are on Medicare. And the interesting thing is we believe that like Medicare Advantage would be a very interesting strategic partnership that we could start to form where we don't shy away from it. We go head on in saying that's the type of payer that we're interested in working with. So I hope that answered the question.
Yeah, no, that helps a lot.
Then we have to prove it for regulatory. That's the second piece. And you also have to prove it for your next, to be able to make claims against that data, you do have to prove it for regulatory, but we're got to walk before we run.
Yeah, great. Thank you.
You're welcome.
Thanks very much, Stacy. And I'm being told that the tech issues have been worked out on our end. So we're going to go back to ELANZA Health. The company has built a virtual nursing assistant service for fertility clinics that automates and augments aspects of care, radically improving patient experience whilst increasing throughput and saving time for clinics. ELANZA is sold to clinics under a B2B SaaS subscription with secondary in-app revenue stream via D2C fertility products and telehealth services. Catherine Hendy, co-founder, will be our last presenter. Take it away, Catherine.
Hi, thanks so much. Sorry about the hiccup. We've come up with a workaround. Luckily, my first job after college was as the producer in a live newsroom. So I am well used to on-screen hiccups.
Go ahead, your time starts now.
So hi everyone, my name is Catherine Hendy and I'm one of the co-founders of ELANZA Wellness. So we're a women's health company revolutionizing the way fertility clinics deliver care. So with ELANZA, clinics can easily connect their patients with a virtual fertility coach for 24/7 care through an app on their phone. Next slide, please. So several years ago, my co-founder and I both went through fertility treatments. And this was super stressful and really sucked, to be honest. And it's partly because of little things like the fact that your medications and your treatment protocol are just written down on little scraps of paper and they give it to you with messy handwriting that you're trying to decipher. And this is even now in the year 2020. So it's no wonder that 12% of people actually end up messing up their really expensive injections in some way. And going through all of this now is actually pretty common. 1 in 8 people now face infertility, and it puts them at far higher risk of psychosocial issues and depression on par with cancer patients. Next slide, please. And another reason it's so tough is that, put simply, it's really isolating. You don't actually end up interacting with your care team that much. So you go into the clinic for around 6 appointments over the 3-month span. And there's a global lack of medical staff at the moment, and that means nurses are doing a lot more of the tasks that doctors used to do. So now they can keep track of, how you're feeling, but not how you're actually feeling. Plus, success rates are really low. They're around 30% on average, if you're lucky, and they're half that if you're late 30s or over. And here's the thing. At the moment, there is basically no lifestyle management to help improve them. And that's despite the fact that study after study shows that lifestyle factors can influence your chances, even by as much as doubling them. So not helping patients with emotional and lifestyle support is leaving massive, painful gaps in care. And these can even turn dangerous when people head to unverified sources online to fill those gaps. Next slide, please. So we see an opportunity to change all of that with our virtual coach, ELANZA. So our platform merges medical and behavioral workflows to help doctors give radically better care right into the comfort of the patient's own home. Next slide. So our AI coach prompts highly personalized lifestyle changes that are most likely to have a clinical impact on outcomes. And interestingly, and quite counterintuitively, clinical data points to the fact that people actually prefer to interact with a virtual caregiver. And that's because it's a judgment-free space. It turns out that it's easier for humans to actually be vulnerable to an impartial and objective third party rather than another human. So ELANZA is fueled by our proprietary data set, which is approved by clinicians from the CDC and other fertility bodies. And she's also a practical assistant with reminders, trackers, real-time answers. And this is all backed up with real-world in-app support via telehealth. Patients can also find products their doctor recommends, as well as events, classes, and a caring community. So it's everything the fertility patient needs in one place. And we want to make this a new standard of care. Next slide, please. So our value proposition to doctors is that they can treat more patients more effectively. And we'll make money by charging clinics a B2B SaaS subscription with a 40 times ROI. And that's from the increase in sales conversion and time saved. And this is in addition to marketable clinic metrics like patient satisfaction and success rates, which are posted publicly. We're turnkey, so clinics can add digital care augmentation and efficiencies literally overnight. And we also generate secondary revenue from our products and services marketplace.
Time's up. Let's first go to Austin for questions.
Thanks, Catherine. Couple of questions for you. I guess there's the easy sort of venture capital question. It's a very compelling solution. How big is this market? And then once you sort of exhaust that market, where do you go next? And then the second question would be, I'm not a fertility doctor. When I look at the ROI that you're describing, sounds compelling. For your target customer, is that an obvious ROI? They immediately draw that connection between what you're doing and the value they receive, or do you need to present some sort of data or business case to compel them to use the solution?
Yeah, so the first question around the market size. So fertility, 20 billion global market, and we do really see ourselves as a global solution. So our expansion is into English-speaking markets initially after US penetration. There's a lot of synergy between clinics in places like London as there are in New York and San Francisco, for instance. And there's a lot of consolidation going on in the industry so that a lot of fertility networks are now global. So there's entry into markets in Asia and the Middle East as well. The fertility market, though, you're absolutely right, on its own isn't actually ever as compelling to VCs who are looking for the $1 billion opportunity. And so our solution, I didn't get to that point on the slides, is actually to extend the lifetime value of our customer into managing chronic gynecological conditions, which are often associated with infertility struggles. So that could be things like endometriosis or PCOS, things that actually benefit from that kind of continuous high-touch care in the home and last a lifetime for women. And so your second point was?
If I'm a fertility doctor and you come in to sell that to me, is that value proposition, the ROI, I think is like 40x or something. Do I immediately connect those dots, or do you need to provide some sort of business case or health economic outcomes to convince me that ROI is there?
Yeah, fertility clinics are really interesting businesses in the sense that they are run a lot more like clear-cut independent businesses rather than lots of other areas of healthcare. It's also an area where the patient, the provider, and the payer are all aligned in trying to get somebody pregnant, in its most simplistic term, in the shortest possible space of time and with a single cycle. For a patient, obviously, that's because they want the baby as soon as possible. For a payer, when insurance is involved, it's because that's a cheaper solution for them. But for a doctor, it really is around the success rate metrics. It's a hugely competitive space, and there's pretty much only one way that somebody can select a fertility clinic at the moment, and it is on success rates, which are posted publicly on the CDC. So our initial KPIs, which we can prove out in I didn't get to that slide either, but our pilot program with 11 fertility clinics, which are 11 of the top clinics in the US, is the initial data from that is already showing that we can prove out on the key KPIs that form part of that value proposition, which are the lift in conversion rates from an initial consultation. There's a lot of attrition where people will contact a fertility clinic, maybe even come in for a free consultation, maybe start the process, and then the graph shows drop-offs at several key points. And our surveys, as well as other data, shows that a lot of the reason for this is actually just around stress and kind of emotional challenges of treatment. And so supporting people through that process and helping them kind of navigate what the journey is going to look like and managing it from a psychosocial perspective is really what's helping to lift that, as well as removing some of the confusion that the current system propagates. So yes, around those kind of those more financially driven metrics. But secondly, intuitively, every fertility doctor that we've spoken to, and we on speed dial with a whole network of advisors, knows that if you intervene with lifestyle, then you can make a tangible impact to outcomes. It's actually going to take a while for us to have enough people come through that we can prove that, because you can't simply obviously you can't compare a patient, because there's no way of saying what their outcome would have been before or after the outcome with ELANZA. So we just have to have a significant volume of people through before we'd be able to make claims on outcomes, which we anticipate in 18 months' time would take us to the point where we'd be able to take that data also to payers as the insurance portion of fertility care increases too. And at that point, the sales pitch, to put it in a slightly clunky way, would also revolve around outcomes.
Perfect. Thank you.
Let's go to Cheryl.
Great. Thank you. I saw that in your description, you did talk about some more brick and mortar four-wall experience competitors. Can you talk a little bit about the groups that are like a carrot that are going after more B2B through self-insured employers, and, you know, how you think your go-to-market strategy, I mean, it is different. How does it win? And then also, even from a program perspective, you know, how are you different? Because people will have options, right, about whether they want to just use Carrot's program through their employer or go through their physician or fertility clinic and be recommended you, or is there no different, like, is it complementary, or how do you think about that?
Yeah, exactly. So we view it as complementary in the sense that a clinic who is in partnership with ELANZA, that somebody accesses via Carrot, via their employee insurance benefit, would still use ELANZA if their clinic was a partner clinic throughout their treatment. So our service is really, really centered on empathetic AI that's able to kind of deliver a daily coached, nudged experience in a way that is not something that is currently serviced by any of the digital fertility companies that are out there. It's something for us where, as former patients, there's a huge gap in the market for a brand which is the brand for fertility doctors. So it's not a kind of third party that you're accessing through your employer, but this is something that's directly tapped in through your doctor, that's a continuation of their own care. So at the moment, everything's very fragmented. You might kind of access one thing through your employee scheme, you might find another through an app, another thing on your phone, D2C. And what we're really lacking is coherence through the process. So from start to finish, ELANZA can kind of follow the patient through every step of the journey. And the other point is that we have a D2C component that has a global reach as well. So patients can go through the process with ELANZA and then recommend ELANZA to a friend or a family member who's really starting out, even thinking about their fertility before the point where they've actually needed to turn to fertility care services. And at that point, it's more of a women's health, kind of educational, kind of getting to know our brand and work with our brand. And so sort of content such as, what are the stats around fertility decline? What are my life goals around building a family? Could egg freezing be right for me? Sort of starting someone far earlier in their journey than even when they're thinking about fertility care. And then through that, we're able to be a lead gen for clinics and kind of complete that network back through to them.
Got it. Thank you.
Thanks, Cheryl. Let's go to Marlon.
Hey, Catherine, great presentation. And I know it's still early days, but do you have a sense of where you think kind of, and it's this clunky way of saying it, but that ELANZA drops off and the fertility coach picks up in terms of kind of usage on the platform?
It's actually throughout. So there are different, and it's highly personalized in the sense that there are different points for each individual. And this is really what's lacking at the moment. So one person's big thing might be that they're going through the process as a single person, like I did. And, their requirement is far more around emotional support and thinking about, over the next 10 years, what is it that I need to be thinking about? What does my journey even look like? And at that point, ELANZA can kind of process the conversation and engage empathetically to a certain degree. And then even actually, our technical co-founder is pretty awesome in the sense that he has built a system that is able to detect changes in emotion in somebody's voice. So if they're using the voice interactivity tool as opposed to by text, then she'll be able to respond with kind of, this sounds like it's really stressing you out. Do you want some more information about this? Or would you like me to connect you with a life coach? Or would you like to connect you with someone who can chat to you more about egg freezing? So that is a very different experience to somebody who, has been through IVF 3 times already. And, this is their 4th go at it. And really what they're looking for is their outcomes edge when it comes to lifestyle. Why didn't it work last time? What are my more kind of like dietary, sleep, supplement interventions? And maybe for her, ELANZA, earlier on in the journey, we have quite a detailed onboarding with lots of different lifestyle information. She'll be able to suggest working with a naturopathic doctor in conjunction with a fertility doctor. So there's no one answer to that question, in the sense that it's done on a kind of highly personalized user flow.
And is that a limiting factor in terms of your scale, the ability to offer that highly personalized support at the time of when the user really needs it?
You mean in the sense of the number of practitioners that we have?
Number of practitioners, and then availability to, because this sounds like it's something where people would want that information kind of real time, or need that support kind of real time. So the ability for that to transact.
So it's actually a global network of practitioners that that are contracted to us. So they're not a team sitting in an office in ELANZA. They're vetted independent contractors with their own highly regarded practices that we built up relationships with. And so it's a platform where they can host events as well. So community events where for them it functions as a lead gen. And for us, it's really engaging community content that keeps patients kind of coming back to ELANZA because they've got a scheduled thing that day, and keeps engagement higher. So no, not in terms of scalability, because we've found the process of finding incredible and wonderfully competent holistic practitioners has been easy, and they all are looking for ways to digitally engage with more people, particularly now, obviously. Yeah, we're really a platform that puts the two sides together.
Wonderful, thank you.
Thank you very much, Catherine. I'm sorry you had a little bit of a difficulty, but I'm glad we were able to find a workaround. So thank you to all the startups that presented. We've heard all 5 presentations. So of course, it's now time for the audience poll. Walter, if you can launch the poll, please. So Walter will be sharing the results in just a bit, but while he collects that, I just wanted to mention that the executive summaries of 4 of the 5 startups will be in the chat. We're having some formatting issues with VigilantDX's executive summary, so we'll ask for an updated one from them and then make it available in the email that goes out to all the attendees. After the conference is over, we shall have links to all the recordings that we're doing for all the sessions. So feel free to scroll through the chat and find the PDFs from today's presentation. And then watch out for the email that comes through next week, which will have links to all the recordings. I think we're ready to show the results. So go ahead, Walter, surprise us. So looks like AireHealth is the audience choice. Can we go to Stacy, please? Go ahead, Stacy.
Hi there. Yay, how exciting. Thank you so much for your votes. I really appreciate it. This was a fun event, and I really enjoyed hearing everyone's presentations. And thank you, MedCity, and everyone that participated.
Perfect. Thank you again to all the judges today for coming and all the startups. I know there are tons of other events going on, digital health events, so I appreciate you taking the time and coming to MedCity.